Terminal weaning is defined as the gradual withdrawal of mechanical ventilation from a patient who is not expected to survive without respiratory support. The two common methods of removing assisted ventilation are terminal weaning, where the endotracheal tube is left in place as assisted ventilation is withdrawn. The other method is terminal extubation, where the endotracheal tube is removed while ventilatory support is removed simultaneously. Also, there are some certain dilemmas that RT may face on a daily basis. Terminal weaning goes against everything that the field of RT respiratory teaches them. The principle of non-maleficence to do harm is violated by the therapist when he or she removes life-supporting ventilation, which results in the ultimate death of the patient. The principle of beneficence is violated in a terminal wean by the therapist because they are preventing the patient from experiencing harm. This ultimately creates a huge ethical dilemma for an RT because their job duty directly leads to the harm and or death of the patient. Also, it can be hard for some RTs to accept the patient's choice of death over mechanical ventilation, which in return forces the therapist to do terminal weaning procedures. They have to come to the realization that the patient has the choice to make this decision even though the RT is trained to keep the patient living and breathing. This is ethical. This is an ethical dilemma for an RT, but something that must do in order to keep the wishes of the patients. In other situations, like someone's quality of life not being up to par as the patient may want, the therapist may have to step in and terminally wean them. Even though the RT feels the patient may have been just fine and live a number of years longer, it's a dilemma they are faced with. The quality of life is a subjective category, but sometimes the RT has to put themselves in the patient's shoes and ask themselves if that's how they would want to be if they were in that situation or scenario. Lastly, religious beliefs can play a major role in this. Even though terminal weaning is not a violation of any law or an act of euthanasia or assisted suicide, it can play a big dilemma in the RT's religious beliefs as a whole. They are pitted between doing what their job entails and possibly going against what they believe in. They may not be killing the patient directly, but they are removing a device that is keeping the patient alive. Again, it's not against the law, but ultimately may be against what the RT believes in religiously and or morally. For a therapist who may express issues regarding terminal weaning, I may suggest to them seeking someone to talk with, whether it be another therapist, family member, or counselor. They should also talk with a facility ethics and compliance officer to either get better knowledge of how things work in the hospital setting, how they might handle it better, or simply talk with them about their situation just to ease their mind. Also, it may be best if they just let another RT deal with the situation and let them do the terminal weaning next time.